Well, hello everyone, and welcome to the February Mini Med School Talk. I'm Dr. David Plitt, one of the cardiologists here. I work at Berkeley Medical Center. I also work in outpatient settings here in Martinsburg, in Winchester, Virginia, and also in Kaiser, West Virginia. And I'm part of the WVU Heart and Vascular Institute. And I want to welcome you to my talk on a community update in preventative cardiology. And I first want to congratulate all of you because you are here listening to me today. That means that you care about your heart health, and that is the most important first step in keeping your heart healthy. So thank you for being here and inviting me into your homes. So I like this idea of mini med school. I wish they had this back when I went to med school. In medical school, this talk is 30 minutes or less. So we have 30 minutes thereabouts to give you a lot of information on a very important topic. In medical school, you take a lot of courses, you take a lot of time learning new skills, you have to read all these books, you have to take tests with all these complicating questions, and I wish that they had this idea of mini med school when I went to med school, because it would have made things a lot simpler. I say that somewhat sarcastically in that you really can't teach a topic like this in 30 minutes, but I do intend to give you a very good overview and a good starting place for the topic of preventative cardiology. So happy Heart Month to everybody. That's probably why I'm here giving you this talk today in February, because it is Heart Month. This is myself and my wife in our Heart Month attire. Of course, it's really Valentine's Day attire. And it's nice that it coincides with the same month as Valentine's Day. Just as we show love with our figurative hearts during the month of February, it's also a good time to think about our physical hearts, our real hearts, and to learn how we can be invested in keeping our heart healthy, not just during the month of February, but all year long. So, a few warnings as I begin my talk. I'm not a dietitian, okay? I'm not a nutritionist. I will be talking about some diet and nutrition topics, however. I am not an exercise physiologist. I do not have any relevant financial disclosures or industry relationships. However, I am a cardiologist who believes in giving practical advice that I try to follow myself in order to empower patients to take charge of their own health, make informed decisions, and remain invested in the entire process. The material covered in this presentation is a general guide. As always, discuss these issues with your doctor who knows you best to know what is best for you, the individual. And remember, medicine evolves. What is true today may not be true tomorrow or in a year from now or even 5 years from now. So let's have a heart-to-heart. I had to say that, of course, right? So I like to start out with a joke usually when I give these talks. If there's one thing I've learned, if you don't want to read all my words or listen to me talk, you can at least look at pictures during this talk. The doctor sits down with the patient and says, well, now that you have it, you can stop worrying about getting it, right? So my hope is at the end of this talk that not only will you not ever develop heart disease, or if you do have heart disease, that it will remain stable, but that you can worry less about getting it because you'll know more, and knowledge is power. So this is the human heart. We've all seen pictures like this. It's a beautiful structure. It is the strongest muscle in your body. Make no mistake about it. If I did the math right, it will beat about 3 billion times in the average lifetime. But it's basically just a pump connected to plumbing at the end of the day, right? The heart is the pump, and it's connected to a lot of fancy plumbing. The pipes are our arteries and veins, which carry oxygen and nutrients to tissues and cells in our body and remove their waste and elimination. As our cardiovascular system is constantly at work, whether you sleep, whether you're awake, and as all of our body's tissues are dependent on it for existence, it's amazing that our heart works so well for so long. It is also no surprise that when it does not work right, it can have severe ramifications for our body. Think about complicated machines, right? This is Dr. Emmett Brown's refrigerator from Back to the Future. Think about how complicated that was, and if one thing broke on it, the whole thing would go kaput, right? Think about our cars, our engines, many complicated pieces of machinery. If one part doesn't work right, our car doesn't go. Think about our computers. If the microprocessor or some other part isn't working right, the whole computer doesn't function. And that's kind of how our human body is. Intricate, interrelated, and certainly if our heart is not working, the rest of our body's machinery will not be working well. So the human heart gone awry. So what can happen? Sometimes the pump gets weak. This is called heart failure. Sometimes the pump's parts have mechanical dysfunction. This would be, for instance, a valve that doesn't work right, a leaky valve or a stenotic valve. Structural heart disease, a lot of this is congenital or can be, so a lot of this occurs in younger patients or pediatric patients, but sometimes adults too. Sometimes the pump is too fast or too slow. This would be an arrhythmia of the heart. Sometimes the pipes get clogged. This is called atherosclerosis. Just like a pipe can get clogged in your house, our pipes can get clogged. And this is what we're going to focus on during the most of the talk, because this is probably the most common problem that people encounter that is preventable and can often lead to these other problems that I mentioned above. So this is a slide from the CDC showing deaths per 100,000 US adults from a few years ago, but it has remained fairly steady since then. And on the y-axis, these are leading causes of death. On the x-axis, you have deaths per 100,000 US population. And as you can see, heart disease reigns supreme, as it has for many years. It's close with cancer, but still edges it out in terms of the leading cause of death in the United States. Now, of course, heart disease is a heterogeneous group of disorders. In the U.S., it largely refers to atherosclerotic coronary artery disease, or blockages, due to cholesterol buildup, which can lead to heart attacks, heart failure, and arrhythmias. This is a slide showing cross-sectional views of arteries that have various degrees of cholesterol buildup in them and even blood clots. It is my firm belief that this is a systemic disease that is potentially, but not always, preventable. When combined with stroke, which is often due to similar mechanisms but affecting the brain, it is clear that atherosclerotic vascular disease remains the #1 nemesis of U.S. adults. This is an example of a blood clot leading to the brain, which can cause a stroke, similar to a heart attack, but in the brain. This can also cause peripheral artery disease, or PAD, which can result in poor blood flow to the extremities, usually the legs, potentially leading to tissue loss and amputation. An example of that. Now, what do we mean by preventive? How can we prevent these things from happening? Well, there are non-modifiable risk factors. These are things you cannot change. The biggest one is age, which remains the biggest risk factor for these problems. Also genetics, family history of heart disease, and gender. Males are at a higher risk than females. And so these things you can't modify. However, the good news is they are outweighed by potentially modifiable risk factors. High blood pressure, high cholesterol, diabetes, tobacco use, obesity, physical inactivity, poor diet, and chronic inflammation. We can do a lot about these risk factors. So this is a slide from The Lancet illustrating the importance of these risk factors. This is from 2004, so it's a little bit old. And what this does is it looks at the odds ratio of having a heart attack with these risk factors. I want to draw your attention to the x-axis. This shows various risk factors: smoking, the presence of diabetes, high blood pressure or hypertension, and high cholesterol. And you can see that by these boxes, individually, these raise one's risk of having a heart attack by anywhere from 2 to 4 times that of somebody who does not have any of these problems. However, if you have all of these risk factors, okay, that risk goes up astronomically. It's up in the several hundred times the risk of having a heart attack compared to somebody who has none of them. So together, these are very synergistic. And so it's very important to keep that in mind. So what do we tell people to do? All right, so we say eat healthy, right? We say make sure that you exercise regularly, right? We tell people to maintain a healthy weight. We say control blood pressure and cholesterol with healthy lifestyle choices, right? We say to avoid tobacco products and other vices. And we say to get sufficient sleep and rest, right? Easy, right? Piece of cake, right? Not really, right? This is hard, like playing this piece of music, okay? This is not easy to do perfectly for years, for decades, right? So what I'm going to do is I'm going to break these down into 1 or 2 slides each to give you some practical advice of ways you can try to do a good job at these important lifestyle modifications. So the first is to eat well and maintain a healthy weight. Okay? Our dietary choices can affect our cholesterol levels, our blood pressure, weight, and our diabetic status or blood sugar control. So avoid the fast food and eat out sparingly. When you eat fast food, you have no idea what's in those foods. They often contain elements that are not healthy. And so while the occasional splurge is okay, you want to make a habit of not eating out or eating restaurant food that you don't know its contents on a regular basis. Okay? We have no idea what's actually in this food. We want to avoid the saturated fats and the trans fats. Saturated fats and trans fats are the types of fats that are most unhealthy, that are linked with higher cholesterol levels, especially bad cholesterol levels. Here's some examples of some of these foods. It's the good stuff, right? The stuff we like to eat, right? And that's what makes it hard. A lot of baked goods have trans fats, which are no longer allowed to be added anymore, but there are naturally occurring trans fats. Food labels are a good thing to look at, right? This is one donut, and this has 52% of your recommended saturated fat intake for the day. So these things can add up very quickly. Cholesterol content actually matters less than we thought. The amount of pure cholesterol in our food, such as eggs for instance, has not shown as much of a relationship with heart disease as saturated fats and trans fats. You want to avoid foods with a high glycemic index. These foods are simple sugars such as sugary beverages and also things like white rice, white bread, potatoes, sweets. These things are rapidly released into our bloodstream. They cause rapid insulin spikes in our body, and that can lead to insulin resistance, diabetes, and poor blood sugar control. So those are some quick hints, okay? So what can we eat? Well, there's many diets out there. One that has been shown to be fairly healthy for the heart is something called the Mediterranean diet. Perhaps some of you have heard of this. It's a diet that's based on countries such as Greece that are in the Mediterranean Sea basin, and these foods have been shown to be fairly healthy for the heart. What does this consist of? Fruits, vegetables, whole grains, beans, nuts, seeds. Olive oil as a source of a fairly healthy monounsaturated fat in terms of a cooking oil. Fish, salmon especially, but other kinds of fish which are relatively high in polyunsaturated fats such as omega-3 fats and healthier fats. Dairy products, eggs, and poultry in low to moderate amounts. Wine can be consumed in low to moderate amounts. Oops, sorry about that. And you want to avoid sugary beverages, highly processed foods, and some of the other foods I mentioned on the previous slide. Is it okay to splurge once in a while? This is a common question we get. Of course, the answer is yes. Eating is important. It adds a lot of enjoyment to life, and it's important to splurge once in a while for special occasions. This is an example of my dinner the other night. Ground turkey, beans, lettuce, tomato, fairly healthy. When I was on vacation recently, this is what I enjoyed. A nice burger with some curly fries and a root beer. So this was obviously a special occasion, and I splurged. So it's okay to splurge once in a while, of course. But if you make a habit of good, healthy habits most of the time, you don't have to worry as much when you have the occasional splurge. I also like dark chocolates around Valentine's Day. All right. Exercise regularly. Okay, this is the next important tenet of healthy lifestyle choices. So aerobic exercise. This is how our heart grows stronger, right? Our heart's a muscle. Just like our muscles grow stronger by exercising, our heart grows stronger by exercising. How do we do that? Aerobic exercise. Running, swimming, biking, rowing, HIIT workouts. There's many examples of things that are aerobic exercise-based workouts. You want to aim for 30 minutes a day, about 5 days a week on average. Okay? Steps are great, okay, but exercise should be a little bit hard, right? I mean, I think step counters are great. Any exercise, any activity is going to be net good for the body, okay? But to really exercise your heart, if you can, you want to make it a little hard. You want to sweat a little bit. You should get a little out of breath. Your heart rate should increase, okay? So exercise should be a little bit hard if you're really going to be exercising your heart and maximizing what you can do to keep it healthy. But any exercise, any activity is, of course, good for the body. Don't go from 0 to 60 overnight, okay? If you have not been exercising, you don't want to go out and train for a marathon the next day, okay? You need to listen to your body. You need to ease into an exercise routine. Not your thing? Well, get accountability. join an exercise group. It can be addicting, okay? This is me getting ready to go out for a winter run when it was 30 degrees a couple weeks ago. Of course, yesterday it was much nicer. But you know, it became addicting. It can become addicting, and sometimes you just can't go a day without exercising if it becomes part of your routine. Not your thing to go out? Well, you can buy a treadmill, a bike. You can join a gym. You can subscribe to one of many online streaming workout services. This is one that I use. This is a 22-minute workout. Very hard, good exercise. It only took 22 minutes. I did it in my house. No time, be creative. This is what inside of elevators look like, I hear. I hear they're very crowded. Lots of COVID may be floating around nowadays, especially if we're not wearing masks anymore. Just kidding. But look, the nice empty staircase, right? You can take the stairs at work, going from the first floor to the 8th floor at Berkeley Medical Center. That's a workout. And you know, this is a way to be creative and working exercise into your day. This is one of many examples, of course. All right. Avoid tobacco products, right? This one's fairly straightforward and easy, although not easy for everybody, right? But smoking is the leading cause of preventable illness. I say this because it is not only the main risk factor in developing heart disease, but other problems. It is the main risk factor in developing PAD, or artery problems in the legs, as well as something called an abdominal aortic aneurysm, or AAA. It is a main cause of premature heart disease, specifically in young patients. And it also leads to other things, right? COPD, emphysema, and many types of cancer, okay? A pack per day amounts to almost $2,000 a year in direct costs. That doesn't include, of course, indirect costs. It affects other people in the environment, right? So the good news is there's help in quitting, okay? There is help in quitting. There are quit lines that can help with advice. You can get text reminders throughout the day. There's many ways that they help you. There's over-the-counter medicines like nicotine patches that can help with the withdrawal symptoms that can be used. So there are many tools out there. And this I like. This is a slide that shows the benefits of quitting smoking, right? And I want you to focus on these. After a number of years, it takes, you know, a decade or so, but you can reduce your risk of having a stroke or coronary disease down to that of somebody who has actually never smoked. And so there is benefits in smoking that accrue not just acutely, but in the long term. All right, get sufficient sleep and rest, okay? So try to average about 8 hours of sleep a day, okay? Sleep hygiene, right? I think we need to put effort into our sleep sometimes, right? Some people benefit from eye masks, a dark room, sound machine, whatever it may be. Invest in good sleep habits and good sleep hygiene. Turn off your devices, right? Don't have your phone or your computer in there where you're hearing dings and dongs and getting distracted if you can, okay? When I'm on call, I have to sleep with my phone, but no other nights do I have it anywhere in my room. Sleep apnea. This is sort of a hidden epidemic, I think. Sleep apnea can interfere with the quality of your sleep. And so if you snore, if you feel fatigued and sleepy during the day, like you're not getting restful sleep, even though you say, hey, I'm laying down for 8 hours every night, it could be that you have sleep apnea. And treating that can greatly enhance the quality of your rest and sleep. I think rest, relaxation, stress relief, all of this is vital to our body's overall health. You know, there's other things today that compete with that try to, I think, increase our stress levels that we can try to avoid as best we can. These are things like maybe social media, maybe not having the news on all the time. These things can certainly increase our stress levels. So just think about ways that you can reduce the stress in your life and, of course, get good sleep. All right. Great. So what do I need a doctor for, right? I can do all these things, right? Well, sometimes these things just are not enough, right? Doctors can offer tests, procedures, medications, advice, accountability. That's what we're here for, right? That's what we're here for at the WVU Heart and Vascular Institute, to help people for whom these things just aren't enough. So I'm going to give you now a little bit of the doctor's perspective. That was sort of all things you can do on your own. These are things that we think of as doctors when we see patients regarding these issues. So blood pressure. So there's actually World Hypertension Day. I didn't know about that till I made this talk. This year it's May 17th. So awareness of the importance of blood pressure. High blood pressure or hypertension is a leading cause of cardiovascular disease, specifically stroke, as well as chronic kidney disease and need for dialysis. The goal blood pressure for most people is now 130/80 or below. This is a change. It used to be 140/90. but we've learned that a little lower blood pressure is better. And so the goal really, in most people's minds, you should think of 130/80 as the goal. Home blood pressure monitoring is very helpful. Office blood pressures don't always reflect what one's blood pressure normally is. A lot of people have white coat hypertension from things like this. And so getting a blood pressure cuff and getting some home values, recording them leading up to your doctor's appointment, bringing that in can be very helpful to your doctor. Salt restriction. So this is a big part of blood pressure reduction. The goal, according to many organizations, is less than 2.3 grams of sodium per day. That's about 5 grams of salt. And it's a little more than a teaspoon. Okay? So salt, sodium, that can really raise blood pressure in a lot of people. And it's not just the salt shaker. It's the hidden salt, right? This is, a can of soup. Nothing against soup. But if you look at the sodium content, it's a third of your daily allotment just from one serving of soup. So you have to be careful, not just about the salt shaker, but about the hidden salt content of a lot of the foods we eat, especially when we eat out and we don't know what's in our foods. The DASH diet, dietary approach to stopping hypertension. This is a diet you can look up online that has a lot of advice on how to have a low salt diet and naturally lower blood pressure. Things to be aware of. There are some over-the-counter medicines like NSAIDs, ibuprofen, naproxen. These can raise blood pressure if taken chronically. Okay. Over-the-counter decongestants like Sudafed. Again, these things have a role, but if taken chronically, they can be a cause of high blood pressure. Prescription medications, certain stimulants, things used for ADHD, oral contraceptive pills, these things can raise blood pressure. Caffeine, the jury's out on that. We actually don't really know if there's a true harm to caffeine. It's sort of one of those unknowns. So I'm not trying to take away your coffee. Obstructive sleep apnea, as I mentioned before, this can impact blood pressure and is a very common thing today that is probably under-recognized in America. Alcohol in moderation, okay? 1 to 2 drinks on average per day for a male, 1 for a female is sort of what's recommended. More than that can cause things like high blood pressure. When all else fails, there are medications. Don't be afraid of them. Some people need them, and they can work quite well in people for whom these other things are just not adequate. All right, let's talk briefly about cholesterol. So we know there's multiple types of cholesterol that float around in our bloodstream. Cholesterol is important. It's a necessary part of our cell membranes, of certain hormones in our body. But it can also lead to problems, right? We have good cholesterol, the HDL. We have bad cholesterol, the LDL. And most of you probably have gotten your cholesterol checked. It's something that should be done every couple years at least. And you'll see results. And those results will come with values. It'll say, this is normal. Are you above normal? Are you in the normal range? And I think that's a helpful start. However, the guidelines are moving away from using absolute cutoffs for what is considered high and moving towards an individualized risk assessment based on one's total risk factor burden to guide treatment. A fancy way of saying, is your cholesterol too high for you? Okay, so is my patient's cholesterol too high for them? Somebody's cholesterol of 110 may not be high for them. It might be very high for somebody else who has a lot more risk factors. And so it's an individualized assessment nowadays, not a, is this above what the lab says is normal or abnormal. So how do we do that individualized assessment? Well, there's many ways we do it. We usually nowadays use a risk calculator. There's many different ones. This one is a 2013 American College of Cardiology one that I use. There's many websites. You plug in all this information. It can be done in less than 1 minute. And you get an estimate over 10 years of someone's risk of having a heart attack or a stroke. You get a number, okay, and your doctor can interpret that number. But that's probably where we're going in terms of analyzing someone's cholesterol. Risk scores, like this one, they are estimates. They don't account for all unique variables of an individual. They do help guide treatment recommendations, though. But sometimes more personalized data is indicated to guide decisions. Sometimes this is not enough, and we need more information. There's been many studies looking at many different variables of what additional information can help us decide essentially whose cholesterol we need to treat. I'm going to talk about one very briefly that's becoming more popular and people are hearing about. That's something called a coronary artery calcium score. This is a non-contrast CT or CAT scan with the cumulative amount of coronary calcium, which is the radiographic hallmark of atherosclerosis, reported as a unitless score, 0 being normal. There's no patient preparation needed. This is widely available. It's available here at Berkeley Medical Center. The radiation is similar to that of a mammogram. It may cost $100 to $200 out of pocket. This is not always covered by insurance. However, for the information it gives, it's fairly cheap. This gives an individualized sneak peek into one's coronary vascular health and helps determine how aggressively to manage certain risk factors, especially cholesterol. It is not for everyone, hence the need for us doctors. We still do have a role. This is an example of a generic picture of what this looks like. This is an arrow pointing to a heart artery that has no calcium in it. This is an arrow pointing to a heart artery that's bright white. It has a lot of coronary calcium in it. This person on the right would be at a higher risk of having vascular events. So what can we do beyond diet? What can we do when we have a lot of coronary calcium or we need to be treated? Well, everybody's favorite, right? Statins. Everybody loves statins. They are the bedrock of treating cholesterol medically, okay? They're very effective and they lower the risk of having bad vascular events. There's other options too. There are non-statin options. There's a medicine called Zetia or Zetamide, which lowers cholesterol. It's been around for quite some time. There are newer medicines. PCSK9 inhibitors, I've listed the few up there. These are injectable medicines. Some are self-administered, some are done in an office or an infusion center that a patient takes that have robust lowering, cholesterol lowering potential and abilities. And there's another medicine called bempedoic acid. So these are the medicines that are most commonly used to lower cholesterol in somebody who needs medicine to lower cholesterol. Okay. One final topic. I want to talk about aspirin for the use of primary prevention. This has been in the news in the past few years. So we've all heard an aspirin a day keeps an MI or stroke away, right? Or does it? So there have been some recent studies that have challenged decades-old studies which suggested a modest reduction in cardiovascular events with a small increase in bleeding events. Several recent studies from a few years ago have cast doubt on this practice and actually showed little to no benefit of taking an aspirin in this situation. The main reason is because we're managing other things much better. We're managing blood pressure better, we're managing cholesterol better, less people are smoking. And so that small benefit that the aspirin gave is now being is now sort of not as robust. And an editorialist said it best, I think. Thus, beyond diet maintenance, exercise, and smoking cessation, the best strategy for the use of aspirin in the primary prevention of cardiovascular disease may simply be to prescribe a statin instead. So talk to your doctor before making any of these decisions to know what's right for you. And I want to remind everybody that this applies to people for what's called primary prevention. This is people who've never had a heart attack or a stroke or any vascular problem. If you have had some of those things, you should almost always be on aspirin and stay on aspirin. One final short topic, dietary supplements. We get asked about this from time to time. There's been a lot of things that have been looked at in terms of benefit from a heart standpoint. Vitamin D, multivitamins, vitamin C, zinc, selenium, vitamin E, beta-carotene, folic acid, homocysteine, even fish oil. Most of these, if not all of them, have shown little to no actual benefit. And so I don't outright recommend them to people. There's probably little harm to taking them, but they haven't shown great benefit in the reduction of cardiovascular disease in people. The one exception is a prescription strength fish oil called Vasipa, maybe some of you have heard of. This has shown benefit in certain populations. This is a prescription strength fish oil, and that is one exception to the dietary supplements generally not showing much benefit. Of course, this is a prescription medication. All right, just remember, in summary, prevention is always better than a cure, and I hope some of these things have been helpful to you all. And in closing, Happy Heart Month. This is me with my boys getting ready to run a very cold 5K. So just a reminder to be active and to try and incorporate some of these things into your lives. Thank you.